Yeah.
breadth of topics.
Yes, we did. This again, we call it the Coach's Corner. Easy access is to our website, jblfinancial.com. Click on the Coach's Corner newsletter icon, but there are also other ways.
That's right.
More fun ways, we think.
That there are some fun. Well,
to interface with us.
That's
right.
You can log on to our Facebook, JBL Financial, or our Twitter, JBL Financial. You can follow us there and get excellent community updates, fun articles about what's going on in healthcare, in the world of finance, and
tweet with Aaron.
And tweet, exactly. We will respond as quickly as possible.
Yes, you do.
Exactly.
They keep me away from the handle.
Well, you tend to be controversial, so you get the clients all worked up.
Sometimes. Well, it's good. You've got to get the juices flowing. It's important to do that.
You know, some people like to relax when they look at the Facebook and Twitter. They don't want to be all lathered up, so we try and keep it fun. We want people to have a fun, enjoyable retirement. So there's a lot of great things on Facebook about things to do with the grandkids, which is always nice, or things going on around St. Louis.
Yes, there's a lot of fun.
Nice community-oriented.
In between the snowflakes. It actually stopped outside, which is kind of nice.
Nice that you have a window view.
There you go. Well, I'm doing a cycle here. I'm looking out the windows, and there's nobody walking around Westport this morning, which is okay.
Well,
what's fun to be, and just so the folks might not forget, we're live and local. We'd love to hear from you. 969 KTRS, star KTRS from your cell phones, or 1-888-550 KTRS.
So live that we're giving live weather updates.
There you go. You know, retirement can be fun.
It can be
fun. And frankly, I think that the whole quest of getting there. The quest. I mean, it can be fun, and we did visit with some. We do see folks every week, which is a lot of fun to do. Many of them are listeners. Obviously, we do see clients as well. We do offer these coaching sessions, and we're going to talk about today. We're going to focus on a coaching session that we had last week, because I thought it hit a lot of very important topics, and at the end of the day, the first question folks really have is, are we going to be rock stars?
You probably don't ask that to other advisors. I think that might be a unique question for us.
I think that's an us thing, because, our job is to try to help folks crystallize their thinking and get them in a position where, when they decide to make that change, that move to retirement, that they really understand their options. And we're going to talk a little bit more about this morning. But I think that before we do that, we did want to get into our healthcare topic of the day.
That's right, and the weather is quite fitting for our Smart Choices About Your Healthcare segment.
Yes, it is.
Because we are going to talk about snowbirds.
Yeah, and if you're listening to us today, unless you're in Florida, what are you doing here?
Why are you here?
This is the craziest time of the year. I mean, I would say that a lot of the planning that we do, especially in, August, September, October, is trying to talk to clients about, hey,
where are you going to go?
Get out of town.
Leave.
Let's create the cash flow. Let's make sure that we can cover those expenses so that you can go out, get out of town for 2, 3, 4 weeks, 1, 2, 3 months, whatever it was. The weather here's terrible.
Also, it's not holiday time right now.
No.
You could come back for the visit. You could bring the grandkids to where you've gone.
This is a great time to be out of town.
Yes.
Exactly, especially with this weather. The flu season, all that kind of stuff going on. So it's really not as much fun. But one of the concerns folks have, especially those that are getting ready to make that change, maturing into Medicare, becoming semi-grown-ups at 65, is the portability of my health plan. Right. Will my health insurance cover me through Medicare, obviously, in my supplement, if I'm here or if I'm in Italy? Or if I've gone to Destin, or a lot of folks going to Fort Myers.
It's a nice spot.
Nice area, I call it St. Louis Southeast. They're going
Naples.
down there, etc. That area. How's my health care plan work, and why would I really want to consider that? Especially with these Medicare Advantage plans that we talk a lot about, are they really portable, and do they work?
So the cool thing is that if you have a traditional Medicare supplement, a Plan F, a Plan G, that's 100% portable because there's no network associated with that policy. And in the past, Medicare Advantage plans were not nearly as portable as traditional Medicare supplements. But over the last 10 years, they've become significantly more competitive. And the cool thing that Medicare Advantage offers, United Healthcare and Aetna both offer this. United Healthcare calls it a passport. And basically what that means is if you have a United Healthcare Medicare Advantage plan that's based in Missouri and St. Louis County or Illinois, wherever you are. Let's say you are a Missouri resident, you live in St. Louis County, and you are going to go to Naples for 3 months. All you have to do is call United Healthcare, and if they have network availability in Naples, then you can actually move your home plan to Naples. You get in-network access. You can create an entirely new list of physicians if you would like. Everything, not just emergency room and ER and urgent care, are going to be covered for you, so you can have routine visits. And if you're staying in a place for, 3, 4, 6 months, it might make sense to start creating a new stable of physicians because you don't have to come back to St. Louis because something happened or because you need a checkup or you need to go somewhere. You can, really kind of create a new life wherever you've gone, at least on the medical side.
Aaron, is there a minimum in terms of the amount of time you need to be staying out of the network to take the time to actually move your plan to a different state?
I think that's really a personal decision. There's no requirement by the plan that it has to be for X amount of time, but it doesn't make a lot of sense you're going on a 1-week vacation to move your network because you're not going to see a dermatologist while you're on the beach. If something happens, that's going to be an emergency.
You still need a primary, though, right? You still would need to have a primary.
If you have an HMO, you would still need to select a primary. But we were talking about the time limits here, which the time frame here, and if you're going to be on a vacation for a week, that's not the time in which you would want to go voluntarily see physicians.
Right.
You would want to, if something happened, you're going to use the emergency room or you're going to use urgent care, and those two options are always considered in network, even if you haven't moved your network using this ability. So, for example, Essence, which is a very popular plan in the Missouri and Illinois area, doesn't offer the ability to move networks because they only are in Missouri and Illinois. They don't have a national network to hook into like United Healthcare and Aetna do. But even with Essence, let's say you're down in Naples and you fall on the beach and you've twisted your ankle and you need to go to the ER, that's in-network. So they're going to charge you the in-network price when you go. So you have a lot of coverage with the Medicare Advantage plans now that you did it in the past. The other cool thing about Medicare Advantage is that for international travel, there is no lifetime cap. With traditional Medicare supplements, they utilize Medicare's lifetime international travel cap, which is about $44,000. So, depending upon what type of travel you are doing, it may even make more sense to have the Medicare Advantage plan than the traditional